Me llamo Dimitrious Alvarez. I am 5 years old and I'm a Latina. I like running in the 100-mile club because it makes me healthy. I like visiting the doctor and the dentist because they make me feel better.
What we know is that there are 2.6 million Californians who currently don't have health care. And among those 2.6 million, about 925,000, so pretty close to a million, call the Inland Empire their home. So when we talk about how Health for All impacts, some of the more urban areas, a lot of the conversation also has to include inland Southern California, the San Bernardino, Riverside metropolitan area.
We interact daily among these 925,000 undocumented, uninsured men, women, and children in the Inland Empire. We live among them. Our children become friends with them. These residents without insurance, when they get sick, they go to the emergency room instead of a primary care doctor or urgent care. People like Francis Beltran.
Hola, mi nombre es Francis. He vivido en esta área 23 años. Hello, my name is Francis. I have lived in this area 23 years. When I first came to the United States, the first 4 years, I had no insurance. We just waited until we got well, and if we really need to go and see the doctor, we just paid cash everything we need, all the services.
One of the challenges that we have in our region is the lack of primary care physicians. Essentially, we have in the Inland Empire, you have about half the physician workforce that you need to care for our communities. We've added a lot of people to healthcare, whether it's Medi-Cal. We're up to about 1.4 million out of a region of 4.2 million. You've added another couple 100,000 through Covered California. It's a lot of individuals who are now needing health care who didn't have coverage previously. So you need the workforce to be able to see them, and that includes the physician workforce.
Really, our focus is all centered around improving the health of the community. So we have a huge physician shortage in the Inland Empire, and so we're seeking to bring in more medical students, which will become physicians, but we're also hiring new physicians that are in specific specialty shortage areas, and we're also bringing more residency programs so that we retain these medical students when they graduate. So everything's geared towards getting more physicians in the area and improving the health of the community.
I know it can be a very partisan issue about the ACA, but ultimately at the end of the day, I don't think anybody would argue that having access to health care is a bad thing.
Frances would agree. Today she teaches others about the importance of preventative health.
I am a health promoter, and my job is to help people to improve health. And I have been a health promoter since I was 17 years old over in rural zones in Mexico. And it's what I love to do, help people to find resources, to get active, to get information, combine tools to improve health.
So if we have an undocumented immigrant from whatever country they may be from, they're not going to seek care until they're very, very sick. And then they're going to come into the hospital. We're going to provide care to them, usually in a county hospital system. And they're going to end up getting much more expensive care than if they had been able to see a primary care physician. Now, everyone says, okay, well, that's not my problem. Well, actually, it is everyone's problem because the county hospital can't pick up that tab, right? So that tab goes to the government, and who pays the government? All of us, taxpayers. So we already have a socialized medicine system. We just have it in the most inefficient form possible.
All Californians should have access to health care, especially preventative care, which keeps people healthier by providing regular checkups, screenings, and early diagnosis of health problems. By approving the Health Care for All bill and adding new physicians to the workforce, this will reduce the strain of California's healthcare system and allow communities like ours to thrive.
Health for All will put in place an expanded version of access to care for children and hopefully for adults in the future. But in order for them to access that care, we need an adequate number of doctors to be able to treat them. And what does this do? What does Health for All actually contribute to with regard to our workforce? What this translates to is that when you have healthier kids, you have a healthier, success rate in school, which encourages them then to go into college and get higher education.
When I grow up, I want to be a doctor to help other people. Can you help my dream come true?